Good afternoon. My name is Tyler Brew. I'm with Monmouth Acts Community Engagement Network, and I have the pleasure of introducing the LADACIN network. Lisa Graul will be speaking with you in a moment. Quickly, I'll tell you, Monmouth Acts is an innovative public-private partnership between Monmouth County government and its human services stakeholder community. The Monmouth County Board of County Commissioners created Monmouth Acts in 2018 to carry out the recommendations of a far-reaching human service needs assessment. A call to action, Monmouth Acts, represents an affirmative response to this call. One key finding showed that county service providers do not generally collaborate to offer comprehensive services to residents, that many residents are not aware or not using services, and that many opportunities exist for innovative strategies to better reach and serve residents. So Monmouth Acts was created with the goal of serving you better together. And Monmouth Acts consists of hubs. The needs assessment identified needs clustered around 7 areas. Monmouth Acts has formed hubs around each of these issues. Each hub examines identified issues and needs and makes recommendations for improvements. These 7 hubs offer fertile opportunities to benefit from Acts collaboration of public officials and community stakeholders, early childhood success, positive youth development, successful aging, housing and homelessness, transportation, financial empowerment, and behavioral health. These hubs, which are integrated through the Monmouth Acts Advisory Committee, will make their mission to support individual and family success through all stages of life. And I'd like to welcome up Lisa Graul with the LADACIN Network. Lisa Lerner Graul, nice to have you. Thank you so much.
Thank you, Tyler. Thank you so much. Hi, everybody. My name is Lisa Graul, and I am the Associate Executive Director of Children's Services at LADACIN Network. I'm in charge of the children's programs, that's 0 to 21, any programs that fall in that gamut. My co-director, Celeste Smith, does all services 21 and older, and we both belong to Patricia Carlissimo, who is the Executive Director of LADACIN Network. So welcome everybody here today, and I'm going to tell you a little bit about our agency. So LADACIN stands for Lifetime Assistance for Developmental and Challenging Individual Needs. And as we dig into this presentation a little bit more, you're going to understand what some of those needs are. So our mission is to provide a continuum of care, including educational, therapeutic, social, residential, and support services to infants, children, and adults with complex physical and developmental disabilities or delays. So this is all across the lifespan, birth across the lifespan. And we're going to talk about how many people we serve and where we serve them and all of that good stuff. Basically, our role is to increase independence and maximize potential of all of these individuals that we serve. Some history, some interesting facts. We were founded in 1947, incorporated in 52. We were formerly known as the Cerebral Palsy of Ocean and Monmouth Counties. We opened up our school program in 1956, our adult programs in 1978. Our child care opened in 1983, and then we started our early intervention services. And after that, that's when we developed some of our group homes that you'll learn more about as well. So we have some numbers here. 70 is the number of years that we have been in service, servicing people. So 70 years we've been in service. During those 70 years, we were able to form some really meaningful partners, and we were able to grow as an agency and really hone in on the model that works for this population. 3,500, that's the number of individuals that we serve, the number of families that we serve, and 14, the number 14 is our number of locations. So we follow what's called a transdisciplinary model, and basically it's when a group of professionals work together consistently over time, pooling and exchanging information, knowledge, and skills. So many of our individuals have therapeutic needs, medical needs, and then of course there's the instruction and recreational needs, and what we do is we blend them all together. all of these people that are serving each individual. So whether it's a physiatrist, a doctor, a nurse, therapists, teachers, just everybody, childcare, teachers, and the like. So those professionals all work together, and I'm going to talk to you a little bit about what that looks like later. Okay, so let's start with early intervention. And before I really get into our programs, I'd like to tell you that each program is not independent or stand by itself. It does in terms of eligibility, and it does in terms of the services provided, but early intervention happens in childcare. Childcare happens in the school programs. Adult day happens in the school programs. We're all kind of blended together, and that's the beauty of the breadth of the agency. And you'll see that as I move forward with the presentation. So early intervention, the services are provided in the environment, and by in the environment, I mean in the homes, at parks, anywhere that a parent would typically take their child, okay? Some of the services are physical therapy, occupational therapy, speech therapy, developmental intervention, and social work. In order to be eligible, you need to be 0 to 3 years old and exhibit some developmental delays, okay? So to give you an example of how this bleeds into childcare, there might be a child in childcare that is eligible for early intervention services. That early intervention provider is invited into our childcare center to train up our childcare staff in best practices for that child. It's really, very important for everybody to be working on the same skills. And then we have give and take childcare. Basically, we're here to maximize the children's overall development, whether it's educational, physical, personal, and social. It's a very inclusive learning environment. Children of all abilities and all ages are welcome. And our primary goal in childcare, one of our primary goals in childcare, is to support family needs. Eligibility, you have to be anywhere from 6 weeks to 9 years old, and we do accept tuition subsidy from CCR. We welcome that. Now we're going to move into the school programs, and I'm going to back into the childcare and how they blend together. So we have 2 school programs. We have Lehman School and Schroed School. Lehman School is in Lakewood on Airport Road, and Schroed School is in Ocean Township on Neely Boulevard. They are sister schools in every way, but they have their own heartbeat. We serve the most complex and dynamic population. We follow a state-approved curriculum. In fact, we're a state-approved private and are bound by all regulations as the Department of Ed schools. We have robust therapy services. We have medical and equipment clinics, and we have rich professional development for staff. In terms of eligibility, you have to be 3 to 21 years of age, and it's Department of Education funded. So how childcare fits into our school programs is that there's an integration program so that our childcare program spends time in our preschool programs. And it's a true win-win because you might have some children that haven't experienced anybody with special needs. So the integration is critical there. And then it's really good for the children in our special needs programs who experience the curriculum together because they share the same curriculum. So it's a really great way to integrate. And they're on site together, so it makes it really easy. In terms of our adult day programs, and this is where we get into the 21-plussers, we provide educational, vocational, social, therapeutic, and recreational services. You have to be 21 years of age. Services require Medicaid eligibility and registration with DDD, and private pay contracts are also available on request. So the way that the adult program leads into the school program and childcare and such is that in terms of the vocational piece, we do have adult clients who work in the childcare center, and we have a transition program from the school program with our older school students for the adult day program. So everybody kind of knows each other, and there's a comfort level there for the families and for the people that we serve. We also have residential services. We have single-family residences and apartment complexes. We serve developmentally and or multiple physical individuals with developmental and or multiple physical disabilities. And we also serve independent individuals with disabilities. And there are 9 locations across Monmouth and Ocean counties. So eligibility, admission by application, you must have developmental and or multiple physical disabilities, must meet HUD and DDD criteria, and Medicaid may be required for that program. We also have an Access Unlimited program. The services provided there are vocational training and supported employment. The eligibility is 21 years of age. Again, require Medicaid eligibility and registration with DDD. And again, private pay contracts are available upon request. So this program is also a beautiful program because this is the program where we really see the people that we serve in the community. We have an individual that works at the Blue Claws. We have an individual that has been employed with a local hospital. So this is where those skills are attained to get into the community as well. So in terms of community partners, we have so many, more than 75 over the last 70 years that we've been in existence, but we just chose the 75 that we are super active with. These are community affiliations, much like you, Tyler. Thank you for that. Funding, licensing, and accreditation, meaning Department of Education, Department of Disabilities, OOL, and CCR and other types of places. Educational affiliations, and this is a big one. We consider ourselves a teaching organization, and so we have people from all over universities, different colleges, not even in Monmouth County, in Ocean County, calling us, Seton Hall, Monmouth, Rutgers. They always call and want placements with us for teaching and for therapy. And we have such good relationships with those places. Many times the students that intern with us wind up loving it so much and working with us. So it's really a beautiful program. And of course, annual corporate sponsors. And I was just telling Tyler before this, without our different sponsors and our different affiliations and with the community support that we get, there's no way that we could do what we do. So I want to thank everybody for that. And of course, our volunteer groups. And again, after 70 years of being around, we have people that really, really want to volunteer. And there's so many of them that I'm a little bit reticent to even call out one name for fear that somebody might feel a certain kind of way, but thank you to all of our volunteers. So if you want to go to our LADACIN.org website, see if I can take you there real quick. You can see where a lot of our stakeholders will share. I'll just pop onto this one, see if I can find you. And if you go, there's so many different pathways through this to find all kinds of different things. But if you go on, you can see all kinds of blogs, and you can see stakeholders where they talk about the services that we provide. I encourage everybody to go to our website. There's so many different programs and services. I talked about a lot of them today. But to really dig in, you just have to go on and take a look. I can open up the floor to any questions and answers now.
I'll tell you why I'm here. I have a 39-year-old son who has had a whole library list of disabilities, including a 90% hearing loss and learning disability. Had a stroke at age 9, undetected for several days, and anyway, he works at Monmouth County Library in Ocean 3 days a week for 10 hours, but he has almost no social life. And I know people with learning disabilities have problems with that. I'm just wondering if you offer anything that you might want to get involved with.
Sir, I don't know if we have any specific programs for that, but you can take my card at the end of this, and Tyler and I can certainly connect you to several places that you can find that social piece.
Great.
Absolutely.
Okay.
Absolutely.
Good.
Thank you so much. And thank you for coming. I really appreciate it.
I can get an audience.
I had a couple of questions, Lisa. Your schools, you said they're accredited as private schools, so all the teachers meet all of the standards any public school teacher or private school teacher would meet.
Absolutely.
And then the residences, are they equipped for people with disabilities? Like they have ramps or whatever they might need special?
Again, we go by very stringent guidelines and rules by our funding sources, and all of that are part of regulations. Every single funding source has code that we have to follow. Absolutely.
That's amazing that you can provide that. I had no idea. And then my last question is just, I've seen the buses for so many years and never knew what it was all about. Can you tell me, are the students transported to school, or do you go on outings or field trips? So when we see those buses around the county, what are they doing?
That's a great question, Lisa. So our buses that you see with LADACIN on it are actually transport for our adult day clients and to and from group homes. Our school students are transported by district buses. However, we do have buses that have been retired that we use for field trips for the students. Unfortunately, the field trips have been, during the summer we could do a little bit more, but because of some restrictions right now, we haven't been getting out in the community as much as we'd like. But just to give you an idea, one of my schools took 73 field trips in 1 year, the year before we entered into the pandemic. So we do get into the community quite a bit with that transportation.
That's wonderful. Well, any other questions? No? All right, well, on behalf of the Long Branch Free Public Library, I'd like to thank you for being our community spotlight today. This recording will be available on our YouTube channel for later viewing or for sharing. And thank you for being here and providing us with this really important and amazing information.
Thank you so much for having me, and on behalf of LADACIN, thank you. Thank you so much. Have a wonderful day.
Thank you.